Welcome to the deep dive. Okay, so for decades, the 340B program, it's been absolutely crucial for safety net providers, right? Helping stretch those
This is
resources.
a real cornerstone.
But now, things look like they might be changing. HRSA has introduced this, well, pretty radical new rebate model pilot.
Mm-hmm.
And this isn't just some small policy adjustment, is it? This feels like it could be a major shift, potentially impacting how care is funded for, the most vulnerable.
Mm-hmm.
It really affects every covered entity.
That's right.
So in this deep dive into the weekly 340B news, we're going to unpack what's actually in this proposal, see how different groups are reacting, and really try to figure out what it means for you. Let's get into it.
Okay. So on July 31st, 2025, HRSA, the Health Resources and Services Administration, they put out this draft guidance, a new 340B rebate model pilot.
Right.
And it's it's a very noticeable shift away from the upfront discount we've had since 1992.
The model everyone knows.
Exactly. Historically, covered entities got that discount right when they bought the drug. Immediate help with cash flow.
Commercial.
Crucial. Now with a rebate model, they'd have to pay the full price up front, then wait to get reimbursed. That's a big change in working capital, potentially risky.
Yeah, sounds like it.
And this guidance, it came after some federal court rulings basically said, yes, HRSA does have the authority to approve models like this. That followed lawsuits from drug makers who had proposed their own versions.
Ah, okay. So the pilot itself, it's specifically tied to drugs picked for Medicare price negotiation in 2026 under the Inflation Reduction Act, the IRA,
That's correct.
which seems, well, narrower than what the drug companies originally wanted, right? Is this HRSA maybe testing the waters, or is there some other reason for keeping it focused like that?
That's a really good question. They haven't explicitly said, but linking it to the IRA drugs for 2026, it does suggest maybe a cautious, limited start. Testing the waters, like you said, before maybe thinking about anything broader. So under this proposed pilot, the manufacturers, if they get approved, have to pay the covered entity the difference, between full price and the 340B ceiling price.
Okay.
And they have to do it within just 10 days of getting the claim.
10 days, that's quick.
It is quick. And they also have to cover all the tech and admin costs, make sure data's secure, provide customer service.
Okay, so the burden isn't all on the entity for the admin side then.
Right, that's specified. And crucially, claims can't be denied for diversion, drugs going to ineligible patients, or for Medicaid duplicate discounts. That offers some protection.
That's important clarity.
Definitely. But denials can happen to comply with the IRA's maximum fair price rule. So there's that linkage again. Manufacturers have to get their detailed plans in by September 15th.
Tight deadline.
Very. Decisions by October 15th, and then any approved models kick off January 1st, 2026.
Wow. Okay, that 10-day turnaround is fast, but the initial outlay, that sounds like a potential cash crunch for a lot of places. I could practically hear the finance teams reacting. You mentioned a figure earlier.
Yes, well, the providers are definitely expressing deep concerns. 340B Health, they represent, over 1,600 hospitals.
Yeah, big group.
They really highlighted the financial and administrative burdens. Their CEO, Maureen Testoni, she pointed to an analysis showing that if this went fully to rebates, disproportionate share hospitals might have to fund over $72 million on average.
$72 million.
Ish.
Average. Wow. That's not just paperwork. That's serious money tied up. That could genuinely impact patient services.
Exactly. It's a direct strain on liquidity. Critical care could be affected.
What are other big provider groups saying? Is it a similar reaction?
Very similar tones. The American Hospital Association, Amy Coleman there, called it a significant departure and even a dangerous precedent. She argued that the drug manufacturers essentially, quote, manufactured the integrity problems they're now claiming this model solves.
Strong words.
Yeah. And Bruce Siegel from America's Essential Hospitals, he basically said it means more bureaucracy, more paperwork, making the program much more expensive to administer, and that ultimately only the drug manufacturers really benefit.
Okay, so providers are clearly worried about the operational and financial side. What about community health centers?
The National Association of Community Health Centers said they're still reviewing it, which kind of tells you how complex the potential impacts are.
It really underscores the challenges. Navigating these kinds of regulatory and, frankly, financial shifts takes serious support. Which actually brings us to our sponsor. This deep dive into the weekly 340B news is sponsored by Aventi Health, They're a customer-friendly, innovative TPA trusted by over 300 covered entities.
Right. Now, on the drug industry side, the reactions are, well, maybe predictably, a bit mixed.
Okay.
Sanofi, for example, said they're pleased HRSA recognizes the need for fairness and transparency, but they still feel the pilot lacks the substantial and swift reforms that are needed now.
So, good start, but not enough.
Essentially. Johnson & Johnson also talked about supporting greater transparency and accountability. FHRSA, the big industry group, Pharmaceutical Research and Manufacturers of America,
Right.
they called it a positive first step, but they think it really should cover all medicines and deal with broader program integrity concerns. They're basically saying the whole program needs more oversight, not just this piece.
Interesting. So they want more changes, just maybe different ones focused on their view of integrity. Anyone else?
Yeah, interestingly, Calderas, which is a software provider in this space, they see the guidance as a positive development for finding, solutions that work for both sides.
Okay, so a tech perspective seeing opportunity there.
Sure.
All right, stepping back from all these reactions,
Yeah.
what really stands out to you here? We've got this clear regulatory move, a pilot tied tightly to the IRA, and really strong, very different views on what it means.
I think the biggest thing is this potential shift in the financial burden, Moving from upfront discount to back-end rebate fundamentally changes the cash flow and risk profile for covered entities.
Absolutely.
Which leads to, I think, the most important question right now. With these tight deadlines, September, October, January, and this potential financial hit, how should covered entities be preparing? How do you best navigate this new landscape?
Especially if this pilot expands later on, right? If it becomes the norm.
Exactly. This isn't just about ticking a box for compliance. It feels like it might require a fundamental rethink of operational and financial strategy for some.
We've definitely given you the key insights to stay informed on this really critical 340B development. Something to keep thinking about is how this could really reshape the future of safety net care delivery. Until next time, keep digging deeper.